I just want to say welcome this morning to our first seminar for the programming series related to program inventories. Okay, the seminar introduction. Essentially asking some questions. A lot of you I have not been formally introduced to, so I think it's good to just go through some general questions so that you guys have an understanding of where we're coming from. First, what is CSAC and the Support Hub? CSAC is the California State Association of Counties, and its primary purpose is to represent all counties in California, all 58 counties, before the legislature, administrative agencies, and the federal government. CSAC internally is comprised of a couple areas. Understandably, we always have that amazing administrative and operations staff that keep the day-to-day running, but there are two main areas within CSAC, the operational area. The legislative advocacy side, which really deal with hands-on advocacy impacting counties, and then the nonprofit California Counties Foundation side. Under the California Counties Foundation umbrella exists a CSAC Institute for Excellence in County Government. It's really a continuing education resource for county officials, executives, and senior staff. Many of you are probably aware of that. And then under that same nonprofit side is the CSAC Support Hub for Criminal Justice Programming, which is the team before you today. This hub was created ultimately to be a free resource for counties to partner with CSAC technical assistance and capacity building in our partner counties to really make more evidence-based and data-driven decisions in a number of ways foundationally that we'll discuss in detail throughout both of the series that you all have registered for. I do want to just stop and take a second to thank a couple of partners because we're only able to do this work, especially as a free resource, because of our partnerships that we have. And that is John and Laura Arnold Foundation and the Results First Initiative, a project of the Pew Charitable Trust. So thank you to those that are helping make the CSAC Support Hub an actual viable project that can go to the counties. Finally, our Support Hub team right now is comprised of myself and 3 incredible project consultants. I have personally about a decade of experience working with the California Department of Corrections and Rehabilitation over budget policy, and most recently overseeing admin and community programming as the Deputy Director for the Division of Rehabilitative Programs. Finally, although you likely know most of them, have talked to them, and have worked with them, we have 3 current consultants, Michael Wilson, Kevin O'Connell, and Mia Bird. You'll be introduced to them throughout the series and the seminars in a number of ways. They come with decades of combined experience in the correctional system, and surrounding county work, and have truly brilliant minds. I'm blessed to have each of them as a lead with partner counties through this work. For more information on the work that they've done or some of their bio, feel free to visit the website that we'll be putting out today. They are on there. I would take a full hour and a half to talk about all that they've done, so I'm not going to do that today. Okay, second, what will we cover in the series? As part of our work within the hub, we have developed what we call the strategic framework. I'll discuss that in more detail in just a moment. The goal of both of the series before you that you could have registered for, 1 or 2, is really to allow counties to develop the foundational practices and tools to inform decision-making at the local level. With programming and operations, and even more so in the current political environment, a narrative alone of how things are going is just not enough. So I won't bore you with my work history, but I will say that contained in both of these series in total is so critical to know what you're doing and how you're doing it. We've embarked on a similar vision here that these series cover. And in an audit with my prior employer, which wasn't great at looking at the years before I oversaw programming, even with recommendations from the auditor, we didn't change a single item within our strategic plan, a single vision, a single thing, because of the components that are in these series before you. That's the criticality of this work, because the framework really does build upon operational practices, and really is why I'm so excited to be a part of this. Now's the time for this work. There's always that saying, there's no better time, but it's so true here. Not only are counties continuing to improve practices on their own, but realignment growth funding often depends on your outcomes, and it looks back a couple years. So when you're ready and we're back at the growth stage, you want to stand ready and in a good place to get that funding. How we structure the seminars versus technical assistance. You might have read into the series descriptions a little bit, but these will be structured in 2 ways. First, for counties that are newly partnering with CSAC, we hope the seminars will be a way for counties to walk away, use the resource documents, and really begin work on the components. Have knowledge of how to do it and how to approach it. For counties that have been doing this for years, we hope that it's a way to kind of revitalize the conversation. See if there's something you may have missed, something more you could do with the work, really revisit the components and offer up some expertise and kind of what you've done and what you've built upon in your process with the framework components. Additionally, for all partner counties, you'll have your designated county consultant, along with myself, follow up outside of the seminars to provide hands-on technical assistance for areas to help get through really complex components of the framework and to really help guide you through the process. This is kind of a really important piece. Some of this work is extremely complex and can take quite a long time. So don't set yourself up to fail, but we're here to help, and your county consultant, as well as myself, will be here to help guide you through really implementing each of these components, because the technical assistance is such a critical portion of this. If you're not currently a partner agency or county, meaning we haven't talked to you about the framework or the plans and you're interested, please feel free to call me or email me. And even if we can't commit to significant technical assistance at this time, we're always looking for additional resources so we can expand this really important work. And I'm also full-time here at CSAC, so I'm happy to help counties or agencies with any level of engagement that they have. That means, reviewing old work that you've done, looking at contracts, scopes of work, seeing if it has accountability or fidelity, brainstorming on ideas at the county level, and how to begin taking steps. Really here to help with all that. So don't hesitate to reach out and start the conversation. What would we ultimately like to accomplish by the end of the series? By the end of the series, our goal is for you to have really a knowledge and approach on this capacity and operations building efforts, to make progress in each of the framework areas, and to inform how you can approach programming data while making effective evidence-based decisions, and really help tailor operations in a meaningful way so you can start heading down that best pathway or the pathway that you've already started, and make sure that you are kind of following best practices. We created these series to cover the topics in the strategic framework in a way that we felt was really the best use of seminar time. And so you'll see some different combinations as we talk through it. Kevin, next slide. Thank you. So what is a strategic framework? I've said it probably a dozen times already. And so for those of you that haven't seen this, it's really a vision, a plan, an ideal for where you want to go and how to get there. It helps create the pathway by showing you the key components, and not only how they build on each other, but how they become such an important part of the overall concept and end result that is really embedded within your operational practices. They really are intertwined in a way that really makes sense. And so the series that we're providing you today really try to help, that we're providing over the next 9 months, really try and help align that. Next slide, Kevin. I previously mentioned it, and although we'll follow through the framework in general order, some of the framework components were combined in seminars where the topics are more easily approached, or spread out amongst 2 seminars where they're more complex. Or in the case of data and evaluation, it's a series on its own because of the detail that goes into it. So today, Kevin O'Connell will be discussing the programming series in more detail, and I'll go briefly through these components of the framework so you have an idea of what they are and just kind of why they're so important. First, we have the program inventory and literature review. As you'll notice, this is broken out into the first 2 seminars for this series, but it's really kind of making a list. What do we have, and is it truly evidence-based and effective? These are definitely not the same thing, and it's important to understand the nuanced detail there. The program inventory and literature review really helps start getting to those answers. Creates a cross-agency list of programs, offering with specific descriptions, budget information, and really matches to the evidence and literature that exists. Essentially, what do you have and what kind of programs are they? Then we go into the logic model and process maps. How do we know what to expect from our programs? Do we have missing pieces? Logic models and process maps really help outline the theory of change for a program. Really answering, what are you ultimately asking? What are the results, and how is it going to be collected? Gets to those questions in a kind of a systematic approach. Many of you are probably already doing that already, but really refining that and lining it up with this entire framework is really important. The third piece is contracting practices. So you have a good program, you've developed logic models, you know what you're asking, but really how do you ultimately engage providers with data to meet client needs, target outcomes with budgeting, and really strengthen accountability and fidelity monitoring in order to actually achieve estimated or intended results. All a part of the contracting process. And even if you don't have contracts, say you have county staff that are doing some of this work, the concepts built within that are really important around accountability and fidelity. And so finalizing that third piece is really important. The fourth portion of the strategic framework is data strategies and dashboards. This is the second series, and it's really surrounding improving monitoring of populations, programs, and outcomes across systems. Creating data dashboard views for a variety of audiences, from your local day-to-day operations to transparency publications on your website. Really, it kind of goes from A to Z in terms of how you should be thinking and looking at data. And finally, the final step, which is really important, and many of you have accomplished this through the cost-benefit analysis, is program evaluation and cost-benefit. Use data to develop program output and outcome evaluations. Importantly, comparing the costs of an intervention to the valuation of benefits. Why is that important? How do we think about that? And it could give you both a set of expectations when taken nationally, or when done locally, it can actually tell you whether a program is working and what's working about it. So these concepts in the last component of the framework are really critical to get to, and it really is kind of the end game for where you want to be at the end of the day. This can ultimately really be used to operationally guide development and changes in programs. So all of these frameworks components taken together really create a system of how you can improve operational practices and really start making evidence-based and data-driven decisions. I just looked at the time, I have gone way over my time. So I want to thank you for joining us again today. I want to toss it over to Kevin O'Connell, who will be walking you through the first detailed part of this session related to the program inventory. Kevin?
Great. Thanks, Ryan. So I want to do a little kind of a brief primer on the programming seminar series. And as Ryan noted, a lot of this is aligned with our strategic framework. And the idea is that we want to kind of lay out over the next, this kind of nine month period, how kind of at least the part on the programming side, if that's the part of the series you're going to be joining for, kind of fit together. Because we try to put a lot of different tools in place that really can help you get a context for all the different ways you're trying to serve the justice-involved population. What we're going through today is going to be more kind of in that first step, really that inventory and that filling that list out. But I want to give a little more information about kind of the next, kind of basically over the course of the next 9 months, what that looks like. But really, it's how do we get kind of system-wide with this? Because a lot of times with programming, it's kind of based on funding streams, on really specific areas of interest, maybe specific kind of high-profile programming, but really not the whole system. And I think that really the idea behind our approach to programming is really trying to take this at that whole level and really kind of get a better perspective on what are the kind of programs you have in place, what are the systems, assessments, what are the ways you're really trying to serve people through a lot of different means. And also then give you some tools that actually do it, because part of the concept of capacity building is really to give you guys both some expert assistance and really kind of how to put this together, but really put the tools in your hands to build this out, because no one knows your county or your system better than you do. And I think part of the philosophy of this is really to kind of make sure you have both some background for why this is important, some really key steps on how to do it, but then also have the tools in place and some examples of how to get there. And also to kind of make sure we're combining a couple different concepts, and both around how to operationalize this, but also things like cost effectiveness, as well as other ways to kind of get at this and also access the literature and what the evidence base is. So the programming idea is to really hit on a lot of different areas, and I'm going to go over a couple different, basically the 5 different areas for our seminar series. Ryan, can you start the poll? What you're going to see in a second is a poll of just kind of your general familiarity with some of these concepts. And I'm going to do a brief kind of overview, kind of primer for the next kind of series of these. But you'll see a poll in a few minutes here. For today, we're going to the program inventory process. And really, it's how do you build an inventory of all the programming you offer the justice-involved population from lots of different perspectives. And if it sounds like it's a list, it's a list. But the idea is if you can actually do it with the right scope and the right approach, you actually get something that's kind of new and different, and not something that feels like it is missing pieces, is focused on one area or not. But really, it's how do you build out that really effective list by itself and get value out of it. In December, we're then going to turn to the evidence, and basically how do you be a critical user of evidence and not just feel like you're, just because somebody found an article or someone told you it works, you got to take that, but how do you actually look at evidence critically and then actually make sure you can then know where to find it. And the idea is that, as good as a list can be, how do you actually start leveraging that list to see what works, what's effective, what do we know about it, and go from there. So that'll be the December seminar. And then first of the year in February, we'll then be looking at how do we actually connect it to operational processes and contracting. We're kind of grouping a couple different ideas here, everything from kind of logic models and how do you kind of build out what your system's trying to do and how do you create metrics for it. But also then how do you actually create sure you can have a process in place to then operationalize that with contractors or even internally. But the idea is to kind of make sure you can, a key piece of this is going to be how do you operationalize things and then connect it to the programs you're trying to design. Then in spring, we're actually going to turn to some key concepts around cost effectiveness and how do we actually build out a cost benefit model. Those of you who've been with us for a while know that cost benefit and cost effectiveness is really something we've been talking about for a number of years. And the model that CSAC has is something that all member counties get to have access to. But there's really some key concepts that need to be discussed and kind of understood before you get to that modeling piece. And this first kind of series just talks through what are some of the philosophical basis for that. Why is measuring costs important? How do you kind of use that to make sure you can balance kind of your resource use across all your needs? And then the last one in June will be then actually how do you build out a cost benefit model to actually do that? Understanding the drivers of system costs, different ways programs can be costed out, and then really to kind of get a better idea of how do you use a model to actually help drive decision making, not just have it be some of dollars and cents attached to it, but really to make it help drive decisions as well as drive conversations in your county. So I'm going to look at the poll here. We've got a few more coming in. End it and share it. So I'm going to pop the poll up and see what people said for kind of their experience with this. But the idea is that for this, we wanted to kind of see, just kind of what people's experience are so far. And it looks like for the inventory portion today, some people have some experience with this, but there's still a fair number of people that, are kind of new to, about 26%. So I think we're really kind of targeting at, kind of the people that probably in that some experience with no experience. And we'd hope the folks that are very experienced will actually have some kind of like Q&A as well as kind of leadership ideas about how they've managed this and how they've used it. So some of this will be kind of new to some of you, but a lot of you, I think, about 5 of you have actually been probably in the weeds of doing this. So I hope you also are kind of a resource to your colleagues as well. The second one looks like there is some experience around applying the evidence. About half, a little over half have had some experience doing that. So I hope we can build on your experience, but also folks that haven't done as much of that. What are some tools and processes? How do we connect the dots on some of those? Let's see, on the programming design and contracting side, looks like there, we're going to have some opportunities there to talk to folks about how to build those out and better improve those. So that's a good opportunity to do that. And then on the cost benefit side, it sounds like about the same. A little under half have some experience doing it, but most don't have that really deep experience. So this sounds like there's some opportunities here to learn and also to kind of also help for folks who do have experience with this to help share their experience as well. Okay, make it go away. All right, so let's jump into the inventory part of this today. So today we're going to be covering kind of the basics of how do you build that inventory out, and really it's that basic list. And so what we want to do today is also define some key terms and concepts around an inventory or program inventory. What's in scope, what's out of scope. How do you really do one that actually gets all that, gets that right mix of system level intervention and that right mix of different parts of the system to really kind of fill out and feel like you have an understanding of how your programming works and what are some of the key practices and tools you're actually using in your county. We're then going to walk through a really kind of detailed list of how you actually would create a program inventory. And that's really kind of the how part of this, not just saying here's some great concepts, but actually walk you through a set of processes and steps to kind of see how you would go from building that list out to actually having a good detailed list you can use and leverage in your county. And then lastly, some examples of how to use it. And this can be everything from how do you use assessment information to how do you look at your programming across a continuum of care, really to kind of give you some concrete examples of what you can do with just the list by itself, not including the evidence pieces, not including the other parts about cost benefit, but really just how do you put how can this list be of use by itself to help you understand programming in your county. So what is a program inventory? Getting to some basic definitions here. I kind of like to think it's kind of a way of putting order to what can be a lot of different angles and agencies and work being done in the county, and a little bit of putting order to what can often be a lot of different perceptions and ideas. But to me, it's an organized approach for identifying programs and practices that can span agencies, budgets, and grants. The more I've worked in this field, the more I feel like there's oftentimes all this really good work going on, but not everybody knows what everybody else is doing all the time because the exposure goes to programs or grants that are somewhat new. The base kind of things you do in your base services you actually offer sometimes don't really get identified. So how do you create that first list that really does feel like it's the baseline for what you're doing? Then everything else builds off that. Because even with a really active grant seeking unit or really kind of active innovation, you're still back to like, what's the base service you're giving everybody? And how do you kind of figure out if that is, what you want to be doing as your basic part of your programming portfolio? Anything you add to it, that can be more, but making sure there's a base level of it. And I think at the end of the day, it's a list, and we don't want to oversell the grandeur. It's not there's nothing innovative about a list, but how you build that list, I think, is what's different here. And having a kind of a clear concept of what you're trying to do and accomplish makes it different than maybe other ways you might build out an inventory. And I also kind of see this stage as really being kind of like primary research. You can't really get to the parts about cost benefit analysis, evidence review if you don't have a basic list that everybody agrees to. because too often these lists are short. They don't actually have everything you're trying to do. So building a list that makes sense and something can be a resource for everybody, it can be a good start. And I think really kind of where all the other work goes from. Everything from data and analysis pieces to anything about cost benefit analysis as well. So what can this look like as a finished product? The idea is you have a range of programs. Some counties have 60, 70, 80, lots of different things. Some have less. But the idea is it's a range of different pieces that actually can be put together and presented in a way that actually combines things like who's the agency actually responsible for the work? What's the actual local programming name? A brief description that actually somebody could take and read and not feel like they have to understand too much about everyone else's work, but actually make sure it's kind of in plain English and kind of written pretty well. And then also things like evidence ratings or expenditures. The evidence rating may come later, but the idea is even with just expenditures, some programming information, and a clear name, you get kind of a better idea of what people are trying to do across lots of areas and also see areas for opportunity. So this is just an example of what does an inventory actually look like when it gets put up. But there's all these different ways our counties have used these in our experience, and also ways that probably when you actually get a list, they can have this base information, how you could use it. But at the end of the day, it's really going to be a kind of a list of different programs and opportunities you have in your county to serve your justice-involved population. Another thing to note, it doesn't have to just be the justice-involved population, as in terms of justice programming. Obviously, behavioral health has a huge kind of part to play in this, as well as other parts of your system. But the idea is at least you can see what are all the different things that are serving this justice population, even if it's not all agencies that are traditionally considered justice agencies. These are all collaborative efforts, and we want to make sure this kind of feels like a collaborative list, not just, again, from one agency's perspective or just the justice system to speak, but actually kind of a lot of different agencies who end up touching these people's lives. So why inventory your programs? I think what I've kind of said a few times is really gives a clear sense of shared priorities across agencies. Like we have a lot of people have strategic plans in their county, they're building them out. How do you make sure that the priorities in the areas where you put your effort and your money and your staff time into are actually what you want to be doing across agencies? Because a lot of times it's hard to see what you are doing across agencies when you have so many different meetings, funding pots, groups aligned to it. This can be a base list for that. It makes your programming and how you define programming more accessible across communities and agencies. A lot of times, a lot of counties want to know what's happening in this city here or this region of the county, and how do we kind of get at which agency is actually responsible for doing it. So in some ways, it can also increase transparency, and also you can also create connections in your own county for what people are doing different things, because a lot of times people forget or don't know all the great things that are going on in a single county, even if they all talk to each other over and over again. So again, accessibility and transparency can be a great benefit of it. Aligned programs and designed to evidence-based implementation. A lot of programming has very specific duration, qualities to it that are in the evidence, but how do you know how you're implementing it without doing the inventory itself? So the idea is that actually using this can help to kind of align, once you've done this inventory, align it to what actually is expected to work in the literature if it is something that has an evidence base to it. A lot of times innovative programs, won't necessarily have an evidence base to it, but at least you have practices, policies, and norms you'd like to see. Doing the actual evidence-based matching can then help you to align those programs better. Or if it's something innovative, are your policies and procedures actually being followed about how you implement the program itself? Better meet client needs based on outcomes and treatment plans. Are the programs you have on offer actually matched up to what your needs assessments say for these clients? If you have a population that really seems to need a lot more kind of population-wise, either education needs or cognitive behavioral therapy needs, how do you make sure that those you actually have the capacity in your county to do that when you actually look at across all your different implementations? So it's a way to kind of make sure you can match criminogenic needs and things that really will reduce future recidivism with the things you're actually offering in the county from a capacity point of view. And I think the most, maybe also as an added benefit here, also develop priorities for data collection for deeper analysis. Some of this will tie into the work that Mia is going to be talking about in the other seminar series, but how do you even know what to start targeting and prioritizing for evaluation? You don't know what you have, because if it's only the programs that are the biggest profile, you kind of miss all the different things that touch people's lives. And how do you actually then figure out what you do want to know if you don't know what the universe looks like? So again, it's back to helping priorities and actually understanding what you don't know so you can go find out more about it and actually make sure you can at some point get to some place where you know more about your programming. So then how do you create the appropriate scope? This, I think, oftentimes is one of the more challenging parts of this, is that what's in, what's out, what are we really talking when we talk about programs? And really, I think this oftentimes is a community decision. When we've offered our technical assistance on this, we really want to start with what the community wants to do, what the county wants to do, and then make sure we can actually clearly articulate that. Because as I said before, a lot of times what's available out there sometimes isn't really the most complete or the most, I guess, has a unifying quality to it. So you feel like you're kind of missing something, or maybe it has things that really aren't necessarily considered programming, but maybe something else. But really kind of identify the key themes and agencies you want to be involved, so it's really clear what this represents, but be clear about it. Because sometimes this can be a big undertaking. You can't always do your whole county at one time, but you can do it in segments, either doing it through areas like agencies you want to focus on. Maybe it's a in custody setting or a community setting, or even a geography in your county, or themes you want to look at, like the transition of reentry into the community, or things that actually are very specific. But you got to kind of identify those up front so you have goals for what you're trying to collect. Focusing on recent budget years for a baseline, and what that means, it helps you to kind of understand like what you're doing in a certain year, but also then create an approach for actually updating those in an ongoing way. And we're usually going to use the recent budget years because it helps to create that baseline, and then also give an expectation of when things will get updated. Because at some point, I think the world's kind of full of lists that get done one time. Ideally, this is a list that gets updated on a fairly regular basis when things change. So there is always kind of that active confidence that this is the list. We don't have to go to a different place. This is that list for sure of. Developing a program lead or a kind of a project lead can be really important, because if this is kind of done by committee, there has to be a way to actually pull it and kind of bring it up to a kind of leadership or ownership, or else it doesn't always succeed. So we've kind of found that really having a project lead can really help in the county to make sure that meetings get made, questions get answered, and there's a consensus approach, that consensus gets made, and make sure that you have kind of a final list. So some level of ownership. And finally, like, what's the home or the champion for it going to be in the end? Is this going to go to your board? Will it go to a CCP? Will it go to a mental health oversight committee? What are the kind of things that actually will be the group to actually own this and take it? Not just have it be something that's kind of worked on at different levels, but really have a home and have a champion to make sure this list is complete, it's accurate, people care about it, and there's the feeling of joint ownership. Last two there, really to kind of create kind of what do you want to do with it when it gets done? So will it get disseminated? How will it get published? Make sure people that are contributing to it are comfortable with what it's actually going to be, either publicized or disseminating to where, how it will be done. On the front end, at least then you don't have surprises later, but really kind of create that publication plan on the front end. And lastly, how do you actually create future recommendations from this? Is that if you find things that surprise you or things you want to do differently, like almost start planning around how you want to move recommendations, because some of those can be inconvenient, some of them can be surprising, some of them may be opportunities, but at least have a way that kind of gets to, if we find things we want to do something about, what do we actually do with them? Who gets those recommendations? And this kind of gets back to the home or the champion of it, but kind of plan that at some point in the future you're going to have things you want people to react to. What does that look like, and where do you kind of take that information? So what are programs? Kind of the details of this. We kind of take we try and take a somewhat broad view of what a program is, but it's an intervention that engages specific participants to achieve a discrete outcome over the long term, as it says there. But what that really means is that if you're going to be targeting an intervention for somebody, you want to know who it's actually aimed for, what good it's going to do for them. So if you're kind of looking for maybe a drug treatment program, you're looking for folks that have maybe a history of substance use and need help of some kind. Maybe that'll help reduce their criminogenic need. But then maybe what we want to look for too is also a reduced recidivism level, but also increased treatment engagement. So how do you kind of make sure that you're looking at these programs that actually have an intent to them and actually have a population that's very specific? And that really helps in kind of figuring out things that are more about supportive things or things that we just do because it's the right thing to do versus something that might be something you're kind of really have a targeted strategy for measuring it and making sure it does complete your goal of reducing recidivism or other outcomes you might have. So a couple of examples of outcomes, reduced justice involvement. This can be everything from fewer convictions, fewer jail bookings, fewer arrests, but really it's that reduced justice involvement as kind of a way to say we want to reduce future crime involvement or recidivism. Increased educational attainment. If you're trying to offer someone a GED program, how do you increase their educational attainment is something you can kind of measure in the future. Drug treatment engagement, improve family relations, decrease housing instability or homelessness. These are all things you can measure down the road to say the idea behind this program is we want to make sure we see in the future these kind of positive outcomes for our community because that's really what's in our plan for these people, but we're also targeting to the actual population that needs that. And too often you have programs that are kind of generally related to recidivism reduction, but those oftentimes aren't specific enough because the needs are often so complex. But the idea is you can actually develop a program and then say, yes, we think this would actually be one that actually would reduce the outcomes we want to see. Also, how do we then account for things like practices and assessments? So much of what's, I think, used in the field, both in with justice involved people, is oftentimes like research-based and really and also validated tools. So how do we kind of include those? And I think as we kind of see those will be kind of added to the list, because you actually can assess the quality or the validity of a research-based model for, say, supervision practices on probation, as well as things like the fidelity and the ability of a tool to actually predict recidivism, then use it in decision-making. But the idea is to kind of map all those out as well. So one, you can then assess for needs using your validated tool, but then also have an approach for actually referring to services and referring to an approach, maybe supervision or reentry policies that actually are grounded in research. And the idea is this can get a better idea of not just what your programs are doing, but what those pathways are. And is there actually, research or evidence that actually shows these can have those outcomes you want? And oftentimes the programs are only as good as that referral network or that referral pathway. What this help can do is actually map out for your system to say, we have these great programs, but maybe we need more in the middle there. Maybe a clear way to assess, a clear definition of what assessment is, a clear way to make sure we can refer to different services. And also gives you a pathway to actually monitoring program fidelity to know if that program isn't doing what we think it's supposed to do or trying to do, how do we then see what we can do differently? And then finally, adjusting supervision or programming practices based on what you're finding. If this looks fairly familiar to folks, it's based on kind of the risk needs responsivity approach to community supervision. And really what this does, it's assess for risk, make sure you're referring to evidence-based programs that are shown to address those criminogenic needs, and then keep adjusting and seeing if that's actually working for your clients in a dynamic way. So the whole idea behind dynamic needs for people is that they're changing. And you can always assess those and see what else that person needs to reduce their future justice involvement using validated tools. But the idea is your inventory would include these to help kind of map out how your programs then connect to other parts of your systems and how they get there. Mike will go into this a little bit more too, but I wanted to kind of, one thing that comes up a lot is that a lot of the programs we have are nested in a way. We call them reentry programs, we call them home-based services, we call them wraparound, we call them full-service partnership. This is a reentry example, but a lot of times programs are integrated together, and that's the point of the program, that there's no wrong door for a program. You just go to this program, and then you might get lots of different things based on the needs you have. Ideally, we do see those as a program itself, but oftentimes breaking those up into their component parts can help see, are those actual components doing what we want them to do? Do they actually serve the needs we want? And are they actually being done in a way that actually matches with the evidence? So for this example, we would have reentry programs and then have 4 rows in the inventory for parenting classes, academic attainment, vocational training, and behavioral health counseling. And then we can also see how much are we actually spending for these component parts, who's actually going to them, how many people, and what are the needs being addressed, to then make sure that our reentry programming actually has that right mix. So the idea here is actually to separate out some of the core components of it, not because these aren't really important to do together and really meet multiple criminogenic needs together, but more because it's hard to assess the thing as a whole if it's just called reentry, because that can mean anything to anybody, but actually being a little more specific also helps people understand what a reentry program is if they're not familiar. I think too often we use these words like we all know what people mean. We think people know what we mean, but if we're not specific enough, people won't really kind of internalize what they're trying to do and what these goals are. But the idea is all these different programs can all have different goals, but they're all kind of leading up to an integrated reentry strategy that also is based in assessment and quality programming. So poll question. So Ryan's going to throw up a poll question here. Does your jurisdiction already have a comprehensive list of programs? I think 10 of the counties that have been working with us for a little while actually already have a pretty comprehensive list of things. We wanted to kind of see who else is on the call. Because one, you may have one and not know, or you actually do. So I'm kind of curious of the group what kind of familiarity is with inventory in your counties.
Hi, Kevin. It's Karen Baker, Alameda County. As you know, we've been working with you guys on our results firsts. So I feel like we have a pretty good handle on our program inventory, although it would be just point in time from fiscal year 18-19. And I'm just not sure if we have a path forward to keeping it refreshed on a regular basis, because as you know, we're struggling with who's going to take ongoing ownership of that body of work. But we do have a program inventory, thanks to your help.
Yeah, well, I think it's always a collective though, and always it's a group effort. And I think you're bringing up a good point. It's got to have a home and kind of a long-term pathway, or becomes a list that is out of date or feels out of date fairly quickly. And 2020 is one of those years too. It feels like 2020 was so unlike any other year. What do we do with it? But I think just having that base list can be really helpful, but making sure it has a place and can actually have a long-term home is equally important. I'm going to share the polling here. We came back with 74% responded. Not letting me share. But upshot here is actually about 50% of the agencies on the call do have one, or they know about it. 20% do not. Sorry. Oh, okay. Sorry, I'm reading it wrong. Half of them have their agency actually has one. Let's see. 20% say the whole county does. About 25% don't know. So maybe an opportunity from this call is actually that if you're working in one of the counties that have worked with us before, maybe that's kind of part of the things we'll do after this call is say, hey, for your county, it looks like we already did one for your county. How do we connect you to the person that did it so you can kind of see what it looks like for your county? But it looks like a fair number of agencies also have done this, and actually, so that's a kind of a good part too. Some agencies have actually completed one. That can also be helpful in kind of knowing what your individual agency is doing. But the idea here is we're just kind of seeing who knows about it, but also who's already done it. But it looks like we have a pretty good list of folks that already have some exposure to it, as well as an agency or at the county level. All right, so I'm going to throw it to Mike Wilson to talk through kind of the steps and kind of what you would do here and how you actually develop your local program inventory once you've completed the scope, kind of got some base definitions in place and kind of created some of those leadership parts to it. What are the actual steps you would take to actually completing your inventory? I'll throw it to Mike.
Great, thank you, Kevin. And that poll question I think is a helpful one as we go through the next set of slides. What I'm really going to be looking at is going through and looking at the list, looking at the different pieces that we typically gather when we work with jurisdictions to create that program inventory and to create that comprehensive list of programs. So as I do that, as I go through the next set of slides, I would like you all to be thinking about that, to be thinking, okay, I think it was about 75% of you either had a list within your agency or within your county, to think about that list, that program inventory that you have, and say, are we gathering information here that is described in these sets of slides? And also to think about, if you don't have that information, what would that look like in your county? Is there stakeholder buy-in? Would you be able to get program information across agencies, not just within your own agency? And what are some of the issues you may have with disentangling programs that, as Kevin talked about, like a reentry center or a day reporting center, something like that, that has a program that's doing multiple interventions. So as I go through each of these, I would like you to keep that in mind of just thinking, okay, how do I relate this back to my county? If we do have a list, are we gathering this information? If we don't have a list, how hard would it be to get this information? Or if that list is just specific to your agency, what would the difficulties be in doing cross collaboration across agencies? So as I talk through the program inventory, so some of the topics we're going to talk about here, cost benefits, one I spent a lot of time in, conceptually can be somewhat difficult to go through the details of how do we map people across the criminal justice system, how do we figure out how to do marginal costs, how do we tie it all together to come up with a number, how do we come up with victimization costs. There's all sorts of complexity in some of the topics we're talking about. The topic we're talking about today, as Kevin had mentioned, is a list, and it's pretty straightforward conceptually. That doesn't mean it's straightforward to actually do all of this, as many of you on the seminar know. There are difficulties in, like I said, disentangling programs. There's difficulties with stakeholder engagement, but the concepts themselves, I think, will be pretty straightforward. It's just will be a matter of having the time and energy and county buy-in to pull all this information. Go to the next slide, Kevin. So when we look at putting together a program inventory, there's really three main areas we're looking at. The first is the program itself. What are the components of that program? What information can we pull about that program in terms of who's being served by that program, what's the duration, intensity? I'll go through each of these of that program. The second piece is not the what the program is, but who is being served by that program. What are their risk levels? How many individuals are being served? How many could be served? Those sorts of questions. And then finally, the expenditures is a really important part of this, because we could have a list that shows a bunch of different programs that we're doing in our jurisdiction, but if we don't know how much money is being spent on it, it's hard to know the relative importance within the county of each program on our list. So those are the three main components. I'm going to go through each of those in a little bit more detail. Go to the next slide, Kevin. I'm not seeing, no, there we go. Thanks, Kevin. Okay, so the first piece, and this is the most basic of anything, it's just defining the program, providing the program name, and providing a description of that program. And so sometimes this is really straightforward. It's maybe a brand name program, something like Thinking for a Change, or something like a matrix program that are a common name. And when you hear that name, you have a pretty good idea of what that program is if you're in the field of doing programming. And then there's others that aren't. Others are homegrown programs. They're programs that maybe have a specific name that is, again, specific to your county. But it's important to get that list down so that you can then tie those names back to a specific program that's in your county to what you're actually doing in terms of the description of that. And although we're not talking about it today, tying that into the research base and saying this program that has X name in our county, maybe it's named something else elsewhere, but it does have a research base behind it. So just starting with that basics of getting the name down, the description of that, so that the average person reading about this program, they may not know, like Kevin had mentioned earlier, what reentry is, but we have a brief description of that, and it describes more detail about what that program looks like. Go to the next slide, Kevin. So when we're looking, and I'm not seeing it, maybe I have a little bit of a lag on my end, but the next slide we're looking at is duration and frequency. And so this is also a really important piece of information to gather when we're looking at what the program is doing, what it's actually accomplishing. And so in this case, you're looking at both duration and frequency. The duration is how long does it normally take for someone to get through the program. So some programs may be very short, a few weeks. Other programs, I think of like the treatment court, can be 18 months or longer. Sometimes sex offender treatment programs can be years, 3 to 5 years for those programs. So it's important to know how long an individual is in that program. But it's also important to know the frequency or the intensity of that program. So are they getting 1 hour per week? Are they getting multiple hours per week? And what are the details around both the duration and frequency, so you get an idea of the overall dosage that's involved in that program. And so this is important, and I'll give you an example. And normally I don't name the jurisdictions I'm working with. I trust that there's no one from the Idaho Department of Corrections on this call. Am I okay to share this one? Hopefully I am. When I first started doing this work, probably 7 to 8 years ago, I started working with the state of Idaho, and we were just trying to figure out the program inventory process and helping jurisdictions work through this, framework and understand what they were doing in terms of programming. And they came back and they had an intensive drug treatment program that they were very, very proud of and that they'd sent a lot of clients through. And we started looking at that program in a little bit more detail. And we found out when we looked at the duration of the program, we found out it was an 8-week program, which seemed pretty short, but you could get a fair amount of hours in that 8 weeks. But then when we looked at the intensity and the frequency of that program, we're looking at 3 hours per week over that 8-week period. So what they were labeling as an intensive drug treatment program actually had about 25 hours of dosage. And as we know, and we'll talk about more in our December seminar about the research base and how we can find out more about evidence-based programs, the research shows that an intensive drug treatment program should be a minimum of 100 hours, maybe even as many as 300 hours for the highest risk individuals. So while this jurisdiction had put down that they were doing an intensive drug treatment program, when we were able to dig into it in more detail and look at that dosage, the duration, the frequency, we could see that it actually wasn't intensive. It was not an intensive drug treatment program. It was more some education, some counseling around drug addiction, but it didn't really fit the goal and what they should be going for an intensive drug treatment program. Can you move on to the next slide, Kevin? So the next piece of information that we gather about the program is the delivery setting and the oversight agency. And really what we're looking at here is what agency is administering the program. Is it probation? Is it the sheriff's office? Is it a program that behavioral health is doing? Is it a program that's administered through the courts, maybe a treatment court? Who is administering that program? And then what's the setting? Is that setting, is it an inpatient treatment program? Is it something that's done in the community? Is it done within the jail? And we found as we work with counties gathering this information that often counties are unaware across agencies that maybe you're doing similar programs that are meeting similar goals and needs, but you didn't realize the other agency was doing that same program. Another example we found is often in jails where they're doing a program, and maybe because that individual's released early, that program's only partially completed, and then that individual's not getting the full dosage duration of that program, and probation may not know that that person already had part of that program, and so you don't have this continuum of care or continuity of services between probation and the sheriff's office. So again, part of this list, again, nothing that is overly complex, but it's very important, as we found doing this work, that most agencies don't have these lists across agencies, and they don't compare these lists to one another, so it's difficult and often unknown what other agencies are doing, and so the clients aren't being served in the best way possible. Move on to the next slide, Kevin. And so finally, this one around program information. This is a combination of looking at both actually the individual and the program. So we want to know what we're targeting in terms of the program. Are we targeting PRCS clients? Are we looking at standard probationers? Are we looking at those who are already sentenced in the jail? Are we looking at pretrial inmates? Who is really being targeted by this program? And then also looking at risk level. Are we looking specifically at high risk individuals, high and moderate? Are we being sure that we aren't mixing risk levels? I think we all know from the research that we don't want low risk clients mixing with higher risk clients. And then what need is being met? Is it an education need, parenting, substance abuse, criminal thinking, some other need that this program is hoping to fill? So in the program inventory, we normally look at this from the program side, but it's also important, if possible, to look at this at the individual client side. And we work closely with one of our counties to do this, and this was actually a county that Kevin worked with, but he was able to look with them at the needs of the probationers and compared those needs to the available programs that were taking place in that county. And in doing that, they found about half of the clients were high risk, and they had a high need for cognitive or antisocial thinking needs. And then when we actually looked, or when Kevin actually looked in more detail along with that county at what programs were being offered, we found that there's about 20% of those individuals, or about 20% of the population, could be served by the programs that were available. Meaning that for every one person who had this need and was being served, there was another 1.5 people who weren't. So the county then began to look and say, okay, can we expand this program? Can we get new funding to expand this program and find new providers to actually meet that need that they knew was there in the county? All right, on to the next slide. I want to go through these a little bit more quickly, as I know we're a little bit short on time, and we definitely want to leave time for questions as well. So the number served and the capacity, getting more detail on the individuals, how many people can you serve with the program versus how many people are being served with the program. And this becomes very important when we look at expenditures and the cost of programs and whether or not you're reaching sort of your full potential and actually getting economies of scale, which I'll talk about in the next slide. I want to give a quick example of this. When I was doing this work in Alaska, and this specific need might not, or specific issue may not relate to the counties here in California, but I think that the same idea will. That in rural Alaska, they had a really hard time getting staff to provide treatment and to work with their problem-solving courts. And so looking at this, they had a capacity problem. They thought they were going to serve a lot more clients than they were able to serve. And looking at this, a lot of that, again, was because they had a really hard time getting staff. They had rural areas where they didn't have trained staff, and so they had to fly individuals in. And as a result, this program was very expensive, and they weren't able to meet capacity, and they had to make a decision of, do we stop doing this program, or is there a more effective way? Can we do remote sessions? Is there some other way to improve so we can hit our full capacity level and then also reduce the cost of that program? So again, the same issues of Alaska don't necessarily apply in our counties, but we've all dealt with a limited number of providers or not having enough staff and reducing not having enough to actually meet the needs that we have for our program and not actually hit capacity. On to the next slide, Kevin. So finally, I want to talk through program expenditures, and really two pieces of information that we want to gather there. One is, what are those expenditures, a dollar amount, and a description of those costs. It's a little bit difficult to see in this with the table that I've included in this, the print's a little bit small. But the first one, this is actual information from one of the counties we work with. And the first one, it was from a behavioral health department within one of the counties, and they did a great job of this. They had the issue that Kevin had described earlier and that we see with a lot of our programs. They had one service provider who was providing a lot of different interventions, a lot of different programs. And so it wasn't simple on how they're able to pull out the cost for seeking safety versus one of their other cognitive behavioral therapy programs. And so what they were able to do is go through and create a percentage or create a weighting. I'm going to go through this in a little bit more detail here in a second, but they created a weighting to say how much, what percentage of the contract that goes to this provider is going to seeking safety versus moral recognition therapy versus thinking for a change. And they're able to break that out and come up with an estimate of what those costs would look like. The other example there is looking at swift, certain, and fair sanctions and a form of supervision for probation. And they did a different approach where they just looked at the number of staff, the training that went into that staff, the supplies and other materials that they had there to come up with a cost estimate for that program. If we go on to the next slide, Kevin. And so really this is just summarizing what I described. But normally when you're looking at expenditures, the biggest one is staff time, their wages and benefits. There's also going to be supplies, materials that we're looking at, maybe curriculum for that programming, training for the individuals who are providing the program, ongoing training to make sure that program is being done well, it's implemented correctly. And then there's also additional costs, drug testing, if there's any medical expenses, transportation that go along with that, other additional costs that go into that. All those things you want to pull together into an overall expenditure amount. You on to the next slide. So an example of this, looking at the reentry center, doing a lot of different things, looking at parenting, education, job placement, counseling, all these different sorts of interventions that we want to measure separately. How can we go about doing this? I've got a simple example here of just weighting this by the number of individuals who are served by each program. And in doing that, you can create a weighted average. You can take the 150,000, multiply it by the 5 parents, divided by the total number of people served in all 4 of these to get a weighting to come up with an estimated cost per intervention. The issue with that is that often a parenting class doesn't have the same, it may serve 5 individuals in a parenting class. It could be much different than serving 5 individuals through an education program or through a job placement program. Can you go to the next slide, Kevin? So we can also weight this by staff time, which is really the ideal way of doing this, and it's what the county that I had described earlier had done. They went through and they looked at that parenting class, and they said, yeah, there's 5 parents, but how many hours are spent per parent? Same with the education program, the job placement, and the behavioral health counseling. So you can then multiply those hours out by the number of individuals, and then you get a weighting for each of those classes, and then multiply that weighting by the total budget amount. I know we're getting a little bit technical here, and I don't want to get too far into the weeds, but I do want to let you all know that we have worked through a lot of these issues. This is working on this in 11 counties now in California, and then working on this in multiple states. We've learned lessons on how to pull this information together, and we certainly can help counties to disentangle from these programs that have many individuals that are served, but maybe there are multiple interventions within that umbrella of that program. You go on to the last slide here, Kevin. So is just an example of what this looks like when we pull it all together. So the the Matrix program is, again, I mentioned this earlier, this is one that's kind of a name brand program. There's sort of a standard number of days. It's usually 3 days per week multiplied by 3 hours per day, normally over 16 weeks. So when you're looking at the overall dosage of this program, you're having around 150 hours of dosage, which again is in that 100 to 300 hour range. This is actually an evidence-based program, which we'll talk about in our December session. It gives you an idea of pulling all this information together. You have a very quick summary of this program, the name of it, a description of the program, who's being served by that program, what their needs are. This quick summary doesn't include the budget information, and we don't have the capacity or population information in here, just simply to save space so you can see that information here. But ultimately, you want to tie all that information together so you know how much is being spent on that program. And we have some examples, I think we'll share at the end of the presentation, as well as will be available in some of our materials of how counties have put this information together, how they put this comprehensive list together, showing all of this information in a way that makes sense to their stakeholders. So on to the next slide, Kevin, and we have a question and answer period at this point. I don't know if any came in. I don't see any coming in through the chat feature, but I don't know if Ryan or Mia, if either of you have any questions that have come in privately of the chat feature that I haven't seen, or we could also open it up to individuals to unmute themselves and ask questions if we don't have any through the chat feature.
Yeah, that's right, Mike. We haven't had any questions come in, but we'd love to hear from folks now if they have thoughts to share about their experience using a program inventory or questions about implementing one. We'll just invite you to go ahead and unmute yourself or raise your hand if you feel more comfortable. Okay, well, Mike, I'll leave it up to you. There's some things we could discuss, but in the interest of time, do you think it'd be best to keep moving forward?
Yeah, let's keep moving forward, and we'll have one more session at the end, another time to ask questions. So if you had a question, you weren't able to get it off in time, or you're having trouble unmuting your phone or something, please type in the chat feature, let us know, and we'll make sure to get that question covered. So I'm throwing it back to you, Kevin.
Thank you, Mike. And I think as we kind of thought about how to show this and kind of do it through a webinar series, it's always best as a conversation. And I think we try to kind of mix both like the imperative to do it, but also, again, like some of the details here. And I think, Mike was talking about the weeds, and I think the work here is not necessarily technically hard. Doesn't take a lot of math, doesn't take a lot of maybe the more complex piece of it, but actually it takes really clear thinking. And I think that's kind of where having some definitions in place and then kind of collaborative effort really is what kind of gets you to the finish line of actually something you can actually use and put to use. And so I think, and we'll talk a little more about some of the materials we have as well, but I wanted to go through kind of some, what can this look like in and of itself? Once you've created this magical list with all these great definitions, what can you do with it by itself? You're not adding any more data to this. It's really just kind of using the list as a, kind of as a resource to then either make changes or get better understand what's happening in your community. And so for me, I try to kind of what I think a good one is, because oftentimes if we just say it's a list, okay, what's a good one? What's one that's not as good? But I think one that when I see the most successful really creates kind of that sense of cross-agency collaboration. It isn't just, each agency puts it on a list and they give it to somebody and then there's the list. It's actually a lot of discussion, because I think agencies are so connected in ways that people who do this every day know it, but you don't always realize it when you kind of look at things. And so how can there really be a reflection of the cross-agency collaboration that's happening all the time? And I think it often leads to good conversations besides just the creation of a list. But oftentimes that really good kind of output being, we also can see how we're all connected here. Give some baselines for key strategies. So if a key strategy in your county is really increasing the dosage or the collaboration or ways that people are really engaging with services and treatment, it can be a baseline to say, how are we doing at that right now? And knowing that strategies, time, money, resources are always changing, at least now we have a base. Where can we go from here? That links back to some key strategies or key kind of planning goals for the county. It basically can get really general, kind of general approaches things that also really kind of look at specialty programs as well. And I think the idea here is that we want to make sure that we're not just kind of saying drug treatment, but actually what kind of drug treatment, what's the setting, what's the approach, because that really gets at what the evidence base is. And I think as people in the field, it also gets at the specifics of what you can and can't do across lots of different parts of your organization in your county. But really to kind of make sure you're getting specific enough where you actually can make sure you can connect it to operations. And also it kind of clarifies and aligns interventions to actually what you're trying to do. Is that we're all trying, I mean, in the justice system, I think the first instinct is to say it's trying to reduce recidivism. But oftentimes the programs you're offering or the CBOs that offer it or even the agencies that offer it are kind of upstream from that. They're not always going to be, you know, in this person's life to the point where they can actually see a reduction in recidivism. So maybe their goal is a little bit different than that. Support their housing, support their recovery. Doesn't always have to be jump right to recidivism. It can be things that are more like an output or something you want to see as a good that's being done, but maybe not jumping right to things that are so big picture like recidivism. But also I think this can also help clarify that. It gives people shape and structure to what they're trying to do. And then it can also lead to kind of more examination. And these are the kind of questions I've seen come up in counties that can kind of help just with the list itself. Is it the right mix of programming? Do we have the right things in place to meet these needs? Is it delivered in the best way for that setting? What are the kind of ways you can actually, is it a closed group, open group? What's the best way to deliver a different kind of programming? How do we enhance reentry continuity? It's not just about having, you know, good programming in custody or in the jail, and also in the community, but how do you make sure people can see that connection between their life as it's about to change and they come out that door to actually program in something in the community? How do you kind of make sure there is some continuity in those warm handoffs? Is there enough capacity in the system to actually meet the needs of the clients in your system? And if not, what are some of the strategies you can put in place to either collaborate or draw on other kind of funds you can kind of find or grant opportunities? Is it implemented in a way that the evidence shows works? And this is back to Mike's example of Matrix. If it's not delivered in a certain way or the way it's kind of been designed in the literature, then really it kind of loses the evidence kind of moniker, because suddenly it becomes you're delivering in a way that's not intended by the research, which is different than just delivering a program by itself. So how do you make sure you're actually delivering in a way that's actually envisioned by the research? And then are we collecting the right information? Is this do we actually have enough information to make, you know, sound decisions and really understand what we're trying to deliver for the justice involved population? So a couple of examples I want to go through, and these are, I'll go through these kind of fast in the interest of time. But for me, like some of the ones I've come across that are pretty compelling is that what this shows on the right is actually the release needs of people from post-release community supervision. Those are the people that are coming out of state prison. They're going to be released to the county to be supervised there. What we kind of found is about over 70% had a high need of those that are medium and high risk for cognitive or kind of thinking, antisocial thinking. What that says is you can actually, like, what are the kind of programs you need to make sure in place that deliver and address that need? And I think in the county to do this, they can then attach, you know, are they offering things like CBT, more recognition therapy, reasoning and rehabilitation, thinking for a change, not necessarily offering all these different programs, but at least saying, what are some of the key ways we can address that need? And not feeling like it's a one size fits all, but actually there are some very specific interventions that if you're offering these, how do you then connect it to the needs of the people that are trying to get it? So again, trying to connect the things you might do on your planning side or on criminogenic needs, and then linking that to the actual programs you're doing to actually address those needs. Developing consistent terminology. You know, criminogenic needs I think has been around for a while in the field. People know of it, but I think oftentimes treatment needs and criminogenic needs get kind of mixed up a little bit. And so I think when we're talking about what's going to be most effective at reducing recidivism, we need to kind of make sure we're talking about the things that the research shows is causal to recidivism and how do you kind of meet some of those needs. And I think a lot of the research shows that really it's the things that are about thinking, cognition, companions, antisocial personality and temperament, and history of antisocial behavior is what is kind of really going to be kind of causal to future recidivism in kind of that big picture, but also other things that are also seen to be recidivism also is impacted by, as you know, family relationships, substance use, employment, leisure, but things that tend not to be and more of a supportive need are things like mental health and housing. So how can we also develop some clear terminology about what we're trying to do with the programming and who we're trying to address and what we're trying to do for it? But the idea here is you actually can get some really clear terminology about what you're trying to do and the outcomes you're trying to meet for this person's case plan as well as their treatment needs, but then also make sure you're including things that maybe are not criminogenic, but also things we think are supportive and you need to have in place or else the person can't meet their case plan needs. But get them some consistent terminology and then use it to make sure everybody understands what we're really trying to do for some of these folks and the programs we're offering. Visualizing the budgets and programs. This is an example from a county that actually was just looking at their CCP budget because they had seen, you know, they have the way they had kind of organized it, they had a very specific amount of money they were spending, and this is kind of the way it was allocated. And what kind of going through it and actually seeing what you're spending on these different programs and linking it up to actually outcomes or strategic goals you're trying to meet, can help kind of make sure you're comparing apples to apples and not just saying it's all for lowering recidivism, because some of the things you might be doing in a budget area or a certain allocation of money is actually more around, basically public safety, making sure there's enough, if it's going to be making sure there's enough people on the street or staff on the street to actually go out and do outreach and keep the public safe. But also maybe what are the actual strategies to reduce recidivism, improve health outcomes, or maybe just support the court process and make sure that is as efficient as possible. Those are all things you might be doing with a certain set of money, but how do you actually compare them and then look at the budget expenditure? And so in this county, they're able to look at all the different program areas that they funded with this, link it up to some outcomes they want to see or strategic goals they had, and then also then plug it in to say, okay, we're spending most of our money from this budget allocation on public safety, a little bit less on lowering recidivism, but just so we avoid kind of saying it's all one big pot of money, but actually saying what are these different strategies and is that the allocation we want to meet the strategies we have? So it's a way to kind of use this list and actually just then combine it in a way that actually combines the ideas of outcome measurement and the expenditures. Use it as a community planning and transparency tool. I work with the state of Minnesota on this, and they actually put this whole list, both the evidence matching, the types of providers, the description online in a searchable Tableau dashboard. So you actually could click on this, and anybody in the community can actually see all the different programs being offered by the Department of Corrections and various community local county services. And really kind of it's a full view that the county has, or the county and the state has, of what's being offered. And so it's a way to kind of be very transparent, but also it's a tool for planning, because you can't always expect what people would need to have access to. And if any of you are kind of involved with either kind of the contracting process or actually doing outreach into the community, people don't always know what's being offered, so they really don't always know what they can and can't do. So this is a way to kind of be really transparent about it, and just offering some basic information can be a great resource. Else people don't really know where to go to say what is even offered in my county right now. So I think looking at ways to kind of make this more transparent and more public can increase kind of the trust that you're actually using public dollars and offering programming in a lot of ways, and also addressing what you're actually doing with that money and how you're actually using it. So again, a way to kind of be transparent and offer it up to the public, but also have it be information that's fairly basic, can help a lot of different people from different points of view. Looking at reentry services as partnerships across agencies, I think is one of the parts I've seen most successful, is that there's all these different groups that are trying to work with people at these various stages of either custody or supervision. And so this is an example where a county inventoried 9 different programs, vocational training, education, thinking for a change, but also looked at, well, what are the ways we're actually kind of supporting what's called a warm handoff between different kind of stages. So someone's getting released from jail, how do we make sure that actually somebody knows what happens next? How do we make sure that there actually is continuity in their education plan? How do we make sure they're actually going to be ready to change and ready to embrace their kind of new life in the community after release from incarceration? What are ways that we can do that? And actually this county actually listed out both the programs they had in their jail, what they actually do to kind of make sure there's a warm handoff between that time of release and then in the community, but then also how do they actually ensure there is some continuity? So it's a way to kind of document what are the different things you're offering at each of these different stages. So it's not just, a lot of different disconnected programming, but also shows that connection across agencies. And the last example I have here is actually more from the behavioral health side. But a lot of the ways you can kind of map things is also saying across a continuum of care. And when I think of a continuum of care, I think of least intensive to the most intensive or most restrictive. What are the different programs that are being offered, as well as what are their names? Because as you look at this is an example of just 4 different programs, but a lot of counties are going to have lots of different things being offered. How do you at least kind of see where they're being offered and to who? To one, make sure are these the right programs being offered at that level of intensity for that program, and 2, are there kind of opportunities to increase training, to increase economies of scale in the county? So you don't just have people providers just kind of doing different things based on kind of what they know how to do, but also make sure it feels like for these different levels of care, there's also some things that are seen to be the best case scenario or the best approach, given the evidence, the dosage needs, as well as the funding in place. And that's a way to at least kind of document the number of different programs that are out there. So what this chart shows is that across these kind of levels of care, from CalWORKS being the least intensive to full service partnership for behavioral health, you actually can see what are the different things being offered and the variety of programs being offered. What this shows is that cognitive behavioral therapy, things like motivational interviewing are offered quite a bit on the outpatient side, almost a dominant approach, but then they're also being offered at different levels too. So how can we kind of either enhance these or be more specific to make sure providers have a good sense of what to do, but then also you can then understand what your system is trying to do other than just offering these different levels of care, but actually what are those interventions and what do they look like? And are they being delivered in a way that's evidence-based to meet the needs of people that you're trying to serve? So I want to turn now to some of the resources, stopping there, that we also have some resources in place to kind of help you do this yourself. We did kind of the webinar online version to kind of walk you through this and kind of get some, kind of have someone kind of walk through it. But the idea is we also have a lot of materials to actually help you do this locally, because part of the capacity building approach we're trying to take here is not just say, here's all this great information, we know all this stuff, now go do it, but actually give you the tools to actually do it yourself and maintain it. And the idea here is we're going to release these, and I think they're already online. But what I've done here is just kind of put them in a single slide. We have kind of 3 things that we kind of use for all of our technical assistance, and these are going to be available online to all of you. Kind of like an overview of what the inventory is, why we do it. So just kind of that basic document. A kind of step-by-step guide, really kind of covering what Mike did, but really it's what are all the different definitions and the steps you need to do one successfully. And then what everybody loves, a good inventory Excel template. Quite vast, kind of a lot of columns, but the idea is it kind of gives you a way to approach this and gather the information. So you kind of know what to collect and how to map it back to the guide itself. But the idea here is that you can actually go through this yourself and kind of start working on some of these as you see them. But also then we're also reaching out to folks that are part of the CSAC hub to actually kind of do a little more technical assistance as well. But these give you kind of a self-service approach to do that. I'm going to do a new share here. On the website here, as you see our Ryan Sousa right at the top there, top right corner. Hi, Ryan. But also we have links to all the different materials, and you'll also be getting the seminar recording as well as the PowerPoint. And then we also have these guides themselves. I'm not going to go through this in any detail because I think they are documents and spreadsheets. But the idea is you have the inventory linked right there, which goes through all the different kind of pieces in the guide to actually pulling this off. And then the guide itself, which actually goes through the template itself and explains what to gather, where to get it, and then how to put it together. So the idea here is you have a lot of detailed information to help you do this yourself, and hopefully any assistance we can offer you, happy to do it, but also want to make sure we give you the tools to do this yourself. So I'm going to throw it back to Ryan. I'm going to reshare this guy. And darn it. All right, Ryan, take it away. I'm going to fix this just a second. My mouse went away.
Thank you, Kevin. So I wanted to open it back up. I think we were going to do some final Q&A and discussion if we have time. I haven't seen anything come in. Mia, do you have anything?
No, I don't have anything yet, but I think, what we have in mind is after this presentation, we're hoping to work with many of you to either initiate a new program inventory or to refresh the one you've been working with or expand the one you've already been working with. And so we'd love to hear from you on anything that came up as you viewed this presentation that you feel like might be a hurdle or a stumbling block or a roadblock in sort of your process and your ability to implement this. And of course, some of you are just hearing this for the first time, so we'll be available throughout the period between seminars to provide support for you as well. But if anything came up for you, it probably came up for other people too, and we'd love to hear from you and have a chance to respond.
While we're waiting for some questions, I thought it would be nice for me to take a second and just say, as you work through this, it seems fairly simple in its concept as you start playing things out, but the work that we used in the state on this was incredible. And if you find a way to create sustainability for this to where every time a new contract or a new intervention comes into the system, you will be able to use this list any day, anytime, any point in the year, and really start finding things about your programming, about your operations that you can help tailor. As 2 examples, by just creating this list and continuing to create it, we found major data gaps that we had in the state where we weren't collecting information that we thought was really relevant just to completing the list. And so we started creating little red flags to say, let's start creating this data. There's other things where we, even though, and you guys in the counties have it much more complex than we do in the state, where we were actually serving the same population in the state system, but in 2 different sections. Mental health was doing the same thing that rehabilitation was doing, and we didn't even realize it because they were doing it under clinicians and we were doing it under contracts. And so by looking at this list, it really created a way for us to have that conversation and say, where is it more cost effective? How can we implement this in a way that's better for the population? And so this list really does just start to answer questions, and you can layer things on there. I get excited, and if you're struggling with what you can do with it, or if you have this list, feel free to reach out, and we're happy to brainstorm with you on what we are seeing and kind of how to continue building this list in a meaningful way for your county and your programs.
Right, just quick question. This is Gabby Olivares from Santa Clara County. Would we be able to schedule consultations to review our current program inventory list with you all?
Absolutely. We'll
Okay, great.
Yeah, absolutely.
Yeah.
I think when we did this a few years ago, I was the one who worked on it with you guys. I'm happy to kind of look at what you did. And I think it's a very expansive list. Boo, who's also on this, on the call today, I think it's a really good list, and I think it really could be helpful just to see what's there and see how to update it, especially with, you also did the mental health inventory as well. So I think you have a really good mix there of not just, referred to behavioral health, but also you have a really specific idea. And actually the slide about, the FSP and kind of the continuum was actually from Santa Clara County. And so I think you guys did a really good job at actually exploring all the things you offer. So I think it'd be really great to see if we can merge that together a little bit and see what else we can learn from really putting the two lists together. So happy to kind of do a consultation later.
Okay, thanks. We'd like to add our FACT program, which is our most intensive forensic program for our criminal justice involved. But, we've gotten feedback from our providers. The list is a bit overwhelming and it's not user-friendly. So we'd like to make it more accessible and more user-friendly as we share it in our criminal justice governance meetings. So people refer to it. I feel like the county staff refer to it a lot, but our providers don't really look at it. So I just want to make it user-friendly for folks and that they find it, informative. And when they have questions, instead of sending us 50 emails back and forth, we can direct them to look at the program inventory and it's helpful to them.
Yeah, and I think that's a great use case of actually, if it can be more self-service, people will a lot of times answer their own questions, but there is a fine line between overwhelming and useful. And I think we can kind of help with what that right mix of, and it's maybe based on what your CBOs are asking now or your providers are asking now, we can kind of see what they really need and if it's, worth, how do we share that in an effective way. So I do think just putting a list out there can be it's too much, but actually a way to kind of help people engage with it a little bit might be a helpful way to do that. So happy to kind of brainstorm some ideas with what the work you've already done.
All right, thank you, Kevin.
Okay.
Any other thoughts? Feel free to just unmute yourself. You can raise your hand. There's a couple of people I think on the phone. That is a *9 to raise your hand and *9 to lower your hand. And in general, just looking for any conversation around maybe people that have done it and what they found some of the benefits were, anything that we have left. Otherwise, I know we're getting right to our time, so we can wrap it up and move on. Once again, I know that we'll talk about it, but we're here as a resource. You can email me, call me anytime, and we'll be able to help you through whatever questions you may have, even if you feel like this is so simple, I don't want to bother. That is exactly where we want to be. We want to be able to be a partner with you on this. Looking ahead, Mia?
All right, so we're going to be having another meeting of this group in 2 months. This is our first sort of introductory and program inventory meeting. And then we will be meeting again to talk about sort of the next stage, which is the literature along this sequence. And before that, we will actually be initiating the second seminar series, which a lot of you are, sorry about that, Kevin, I messed up the slide order. A lot of you are involved with as well. And that seminar series is really running in parallel to this one, but it's more focused on how do you bring together the data you need to really understand your population, understand the programs and the services that people are receiving, and then begin to look at what kind of outcomes they're having. And we can do that in a descriptive way. We can also do that through program evaluation, where we're really trying to understand the causal effects of these interventions on outcomes, and in particular on recidivism. So we'll be looking at that in that seminar series. So we would love for you to join for both, but we really appreciate you being here for this one. And the next step following this series is to really think about, do you need some technical assistance support? And if you do, if you'd like to work with us on your program inventory over the next 2 months, please reach out to us. You can reach out to Ryan. You can reach out to the consultant that you've been working with, and we will get going on that. So I'll turn it over to Ryan for the final wrap up.
Thank you, Mia, and thank you, Kevin, for this wonderful picture. I think it's a peaceful goodbye to everybody. I want to thank you for joining. My contact information is here. Feel free to write it down. We also have the link in the chat, so before you leave, maybe click on the link to the website and just save it as a favorite. We are available. Your consultants, if you are a partner county, will be reaching out to kind of connect and make sure that you're getting all the assistance you need. And I am here anytime as we move forward. And I look forward to seeing you all in November and December and getting through the programming series. But I expect to see more faces next time. Let's see some faces out there. All right. Thank you so much and have a good day.